Welcome back, everyone. It's episode 4 of Dashboard Dissections, Cosmetic Surgery Edition. So naturally, we've been going through surgical things and complications. We talked about tummy tucks last week. This week, I think I'm going to segue a little bit into more med spa stuff. Technically, I am medical director of 2 med spas. And Glow Skin and Wellness is here in Midtown, and Marvel Cosmetic Med Spa and Surgery of Clarksville is obviously up in Clarksville, so that's where I'm headed today. We have estheticians and nurse practitioner injectors at both locations, and then we have slightly different services available at each. In Nashville, we have a lymphatic massage therapist too, actually. Lymphatic massage therapy is great post-operatively, especially after liposuction of any area, really. The lymphatic massage therapy helps. Basically what it does is mechanically it helps mobilize some of the fluid that we inject for liposuction. And I'll go over liposuction. I think I'm going to do liposuction and skin tightening techniques next week. But it helps mobilize some of the fluid that we put in for that, and it also helps stimulate your body's natural fluid recycling system, which is the lymphatic system. It's a similar system that runs near your vasculature, meaning what carries your blood to and from the heart. But basically what it carries is excess fluid in the body. So when your body has extra fluid, or when fluid pools, like in your legs, when you stand for a long time, excess fluid will pool in the calves. And what reabsorbs that is the lymphatic. The lymphatic system is different than our vasculature because there are minimal to no muscles within the walls of the lymphatic vessels. And so they collapse much more easily. If you think about an artery doing that, that would mean you lose blood flow. So if you think about contracting your calf when you run or walk even, your artery has enough muscle to stay open to allow blood flow to the muscles that are working. Veins have a little bit less, that's why they can collapse and sort of get larger when you're really well hydrated, or when they put a tourniquet on, that's why they do that, to make your veins dilate with blood so that they can find them more easily with an IV or a blood draw, what have you. And the lymphatic system has even less than that, so even the slightest amount of pressure will change the diameter of the lymphatic vessel. Now that's great because muscle movement stimulates the lymphatic system and pushes fluid back, and basically that brings all that fluid back to the left chest, where that goes back into the vasculature to be reabsorbed by the body and usually discarded by the kidneys. There are some other ways, stool is another way, but anyway, I wasn't planning to go in deep dive on the lymphatic system, but that's a brief synopsis of what it does. And so stimulating that system to help your body naturally recycle that fluid is really helpful in healing, because your body naturally produces more fluid and sends more fluid to the areas that are healing in order to send the necessary building blocks, amino acids, other healing products to make sure that your body heals well. So we want that to happen, but only to a certain extent. It's like, ooh, there's a nice glare, sorry. It's like Goldilocks and the Three Bears. You don't want too much, you don't want too little, you want it to be just right. Lymphatic massage is also great after tummy tucks. Some people do it after breast surgery. I don't usually recommend it. I don't tell you not to do it, but I don't find that it's extremely helpful in that instance. Now, others do, and that's great. And again, I don't stop you from doing it. The one thing after any breast surgery is I don't want you laying on your breasts, so you'll have to be on your back or standing. Similarly, if you do a BBL, I don't want you putting any pressure on the buttocks, and we'll go over that when we do lipo, but I don't want any pressure on the buttocks, so you have to stand or lay on your stomach for that portion. So anyway, there are some caveats to lymphatic massage for different things, but I do like it also for facelifts, because the lymphatic system can be disrupted by the dissection of a facelift, and utilizing that technique of stimulating your lymphatic system to help drain that excess fluid can be really helpful, even in a small area like a facelift, or even just chin or neck lipo. So all that to say, we offer lymphatic massage therapy in Nashville. In Clarksville, we have not officially partnered, but semi-officially partnered with Betty Lopez up in Clarksville. She works at Adara Spa. She's absolutely amazing. She does extremely good work, and she's who I work with for my patients that live up in Clarksville, Hopkinsville area. She also makes incredible fajas for your recovery if that's something that you're interested in. Other things that we offer in Nashville is the Diamond Glow facial. I am obsessed with the Diamond Glow facial. It's a specialized facial that you can customize in every single facet. There's an exfoliation tip that's diamond actually, and you can use different levels of that. And then there's a pneumatic, basically a suction component as well, and you can change the suction based on what you're doing. So it's a facial that will exfoliate, and then when it gets that dead skin, sloughs all that crap off, it'll suck all of that out and away from your skin. It also will kind of clean your pores, like a super deep clean. Oh, it's so satisfying. And then you get to see the gunk. In Clarksville, we have something similar. It's called the hydrofacial. The only difference is there's not the exfoliating tip. So it's also instilling serums into the skin once the pores are completely clean and ready to receive that. It's great to add on a dermaplane before doing either of those facials, because it will further kind of improve the installation of the specialized serum that, again, you can customize completely in both options. They're great facials, and I also love to add a little light chemical peel at the end. It really just like makes you completely glow. No pun intended, but it is a great service. So that's one of my favorite, like, treat yourself, feel that glow. And when I say light chemical peel, there are a lot of different types of chemical peels, just like there are lots of different types of lasers. But a light chemical peel usually means that you don't actually slough. It just sort of takes away that extra layer of dead skin and gives you kind of a glow without the peeling and sloughing. I'm not a huge fan of peeling and sloughing. But if I'm going to do that, that's something that most women and men who get that done, they do that in the winter, because peeling and sloughing can be uncomfortable. Your skin can be red and kind of raw. You need to be very gentle with it depending on the depth of the chemical peel or the laser that you're doing. So make sure that you really get very clear post-care instructions, even if it's a light chemical peel and they say continue on with your normal skincare regimen. Make sure you know exactly what you should and should not do after a treatment. The most important thing after any facial procedure or any kind of peel, laser, anything is SPF. It's going to protect the investment. It's going to protect that new fresh skin that you've unleashed, uncovered. That glow you're getting is because you have fresh, nubile skin that has not been damaged. So you want to protect it from damage. SPF is super important for that. I said it. It was the title of episode 2, applying sunscreen in the dark. Yes, we still have to do it, as much as I hate it. But it's very important. The second thing that's going to help protect that investment is your antioxidant vitamin C cream. I talked about that in my Get Ready With Me mini episode reel thing that I did for all you impatient folks. I didn't use it as an episode. But that is super important as well to protect that investment. The other thing, we'll kind of dive a little bit into medical grade skincare, but again, I talk about that in my Get Ready With Me reel. So vitamin C is a very volatile compound. And the reason that good vitamin C serums are so expensive is because it is extremely unstable. So in order to stabilize a molecule like vitamin C, it is expensive and it is difficult because it is light sensitive, it is heat sensitive, and there are also things in the air, chemicals and pollutants in the air, that once it touches the air, it can also be changed as well. So you really have to be careful with the vitamin C products. So any of those vitamin C products where you take the cap off, the rest of that vitamin C is not the same grade that you're getting. So that's the reason that I use the Alto Advanced from Skin Better Science. The way that they conjugate the vitamin C is the most stable way. It also has 19 other antioxidants. Yes. Vitamin C is also yellow in color, so if the product that you're using has no tint of yellow or orange, then what you're using is not actually vitamin C. So The other thing is, it may be that they have done the studies to have that much vitamin C in the serum when they sell it, but if the packaging is not appropriate to protect from light, to protect from air pollutants, Skin Better Science has the dark bottle, and it also is vacuum sealed. So there is no air getting in there. You also don't have to do anything special to get every single drop out of that bottle because of the way it's sealed. So that vitamin C is going to stay good, not get changed. I don't know the right terminology because I probably should have looked this up before I did this, but you know, thoughts while I'm driving is the goal. So it will stay good. It will not expire. It will not change because of the way they package it as well. So I know, trust me, I know that skincare is expensive, but when I tell you that there are some products that you really need to spend the money on, I'm telling you, your vitamin C is one of them, because it is one of two things that is preventing any damage. There are two things that prevent damage in your skin, and it's your antioxidant vitamin C cream and SPF. So if there are two things, I would add that a retinol is the third. It doesn't do as much prevention, but technically it does. And actually a retinol can reverse sun damage, and actually it can reverse low-grade early skin cancers. It's one of the treatments for it. So those are the three products that I would really, really strongly tell you are things that you probably need to spend the money on. Sorry for the blurry. The sun is just in the perfect spot. You know what I'm saying? Just to really mess us up here. Okay, we're trying to work. All right, we're trying to get that, I don't know, coffee, you know? Come on. So if you want, I'll link the products that I really and truly recommend. Retinols are another thing that are very difficult. A lot of people have started using tretinoin. And tretinoin is great. It's a prescription. You can get it super cheap. You can get a gel, you can get a cream, you can customize the percentage of tretinoin that's in there. And it is a great, useful thing. But it's not something that's meant to be used long term, because what it can do is it can actually damage your skin barrier. And skin barrier is kind of a hot topic right now. It's very similar to like probiotics and all of that, like GI, flora, what's the word, microbiome. It's a lot like microbiome. There's a lot of subjectivity to a lot of the research. However, what has been shown is that having an intact skin barrier can help prevent new problems or problems from worsening. And tretinoin actually strips that skin barrier when it's used for a long period of time. It's not meant for long-term use. Tretinoin is similar to like a hydrochloroquinone, in my opinion. Again, it's a great tool in the tool chest, but it's not something that is actually meant to be used long-term. It's meant to be used for a short period, 2 to 3 months, usually maximum, to get the result that you need, and then transition to something a little bit lighter that's going to protect the skin barrier. But again, it's not something that you should be using year-round, 24/7 all the time. And it's not something that you want to ramp up quickly. If it's working and being effective for you, you don't need to go up in dose. You need to go up in dose if it's not working for you. And a lot of people think that they just need to get to that 1% tretinoin, but that's not the case. You want to have the lowest dose for the effect that you want. And again, once that effect is reached, then you want to transition to something that's a little bit more skin barrier protective, like a retinol. And again, the way Skin Better does it is the conjugation. So the way Skin Better Science does it is they conjugate that retinol, and so it goes through the skin barrier, it goes through the epidermis, and once it hits the water of the dermis, then it breaks apart and the retinol activates. So it's similar efficacy to depending on which one you get, it's similar efficacy to specific percentages of tretinoin, but it's less damaging and actually less drying. All of these products, however, when you first start them, are going to be very drying. Oh my God, do not look at my double chin. Okay, we're gonna have to change this angle. Sun, work with me. This is not, no, okay. Less damaging, as effective, and protects the skin barrier. So it's a fantastic product. And again, I know there's some sticker shock when looking at these things. That's why I'm breaking down what is worth the investment and what you can maybe save a little bit on. And the reason that it's so important that it hits the dermis is that's where all of the collagen, vasculature, elastin, all of that is really living within the skin. And so when the retinol activates in the area of the skin that it's actually changing and producing that change, It can help also stimulate new skin formation so that it will slough off those top layers and really improve your skin turnover. So that's what you really want your retinol to do. And again, it helps with sunspots, aging face. It helps with like fine lines and wrinkles. It really and truly is a more youthful, rejuvenating product. Now, if you're under the age of 30, it's kind of plus minus if you actually need a retinol. And if you're going to use a retinol, you want one that is lighter, probably 25. I guess not 30, 25. In your upper 20s, you probably should start using a retinol as a prevention. But 25 and younger, you really need something light. You don't want drying. Okay, and the last med spa thing we're going to talk about is injections. So injections and injectables are really a hot topic right now, especially with glow-ups like Lindsay Lohan and Kris Jenner. I almost said Kardashian, whoops. And the differences between injectables and fat transfer, those kinds of things are big, big topics. First injectable, my favorite injectable, is actually neurotoxin. There's a bunch of different kinds now, and a lot of them run on the assumption that if you inject the same neurotoxin over and over and over again into your face, you can develop antibodies. And so the newer ones are mainly to make money because Botox is owned by Allergan, and they can't use the basest form of it because they still own that patent. Maybe not the patent, I'm not sure, but they own it and no one else can sell it. So they've changed a couple of things. Again, I think the big takeaway is that Botox of any kind, Jeuveau, Xeomin, Dysport, Zeoport, I'm putting them all together, Zia, Bota, Nuvo, all of them are an on-off switch. The sun, okay, I cannot. Girl, get it together, okay? But they're an on-off switch. So either the muscle is paralyzed or the muscle is not paralyzed. And there are ways to keep you from being completely frozen. You don't need to be stuck. But that does not depend on the dose. That depends on the location of injection. And also you need to know that if you're not frozen, then you are, in fact, going to have movement. So a lot of people have major preferences of what they want, especially in the 11s, in the crow's feet. Some women want to see a little bit of crow's feet, and that can change as you age, and that's okay. Now, the other big takeaway is that you need to have someone that you can communicate well with, that understands the way you communicate, that you're able to say what you want and know that you're being heard and listened to. I think that's super important in all things aesthetic, surgery, injections. I mean, it's your face, it's your breasts, it's your stomach, it's your body. It's important. You're making an investment, and so you need to find someone that you feel not only does good work, but also that you can communicate well with. That's a huge hiccup for a lot of people, is being able to communicate with your provider. And if that means showing pictures, that's fine. For me, I love when patients show me pictures because that really gives me an idea, and I can really tell them, like, this is not the words that you were saying, so tell me what you like about this, and I'll tell you why that's different than what you're saying. And we can really narrow down the nitty-gritty of what you want. Last thing that I'll talk about briefly is injectables. The ones that, to be clear, okay, I don't do injectables myself because it is such a nuanced subject. There's so much data, there are so many different kinds, there's so much to learn and so much to know that really I feel that for me, doing that is better left to someone who does that regularly. Now, I do Botox injections all the time. That's different. That's more so knowing the anatomy, and again, it's an on-off switch. Whereas with injectables, there are different consistencies, there are different G primes, there are different materials, there are different places that you can and can't use them, there are different off-label uses for them. There's some that are biostimulators, so they'll stimulate collagen and elastin, they'll last a bit longer. There are a lot of technical nuances within that world that I don't have the time to perfect, and so I don't actually do it. And again, they're a great tool in the tool chest, but you want to make sure you're doing it safely. There are a lot of risks associated with injectables. Now, a lot of them last for anywhere from 1 to 4 or 5 years. Some are a little bit less, but most of those are off the market. There are also locations that are going to fade faster than others. So the lips, because it is such a mobile area, for me in particular, because I'm a yapper, it's such a mobile area that those fillers are they're gonna dissolve faster because you're eating, you're chewing, you're talking, you're laughing, you're smiling. There's a lot of motion there. Not only is the filler gonna migrate, but it's gonna get reabsorbed by the body faster than it would be in like the cheeks or the jawline. Those areas don't go away as quickly. The results don't fade as fast. So people get really surprised when they need lip injections once or twice a year when what they're getting injected should last longer than that. But so filler is a great way to kind of rejuvenate the face and give you that more youthful look. As we age, bone also resorbs, the skin just kind of sags and droops. So there are a lot of reasons why the aging face starts to lose volume, but we mimic that with GLP-1s and massive weight loss. So it's a great way to rejuvenate the face and to give your face a little bit more volume, a better shape, better symmetry, and overall, like, just better proportions, things like that. So it is a great tool. It can be super helpful, but you need to do your research and you need to find someone that you can work with that is safe, follows all the necessary protocols and teachings in order to prevent all of the bad, scary risks. And also someone that you can really clearly communicate your goals with, someone that you feel comfortable with. Because if you have a problem, you're going to have to talk to them through it. And that's hard, no matter what. Risk that a lot of people don't want to talk about is that injectables can cause blindness. And the way that that happens is if filler of any type is injected anywhere near a vessel, an artery specifically, all the different cascades of the arteries of the face, they all kind of talk to each other. And the reason for that is when you lay on your face, you don't want to lose blood flow to a certain area. So a lot of the areas talk to each other, including the eyes, the chin. Those blood flow areas have, I cannot think of the word right now, but they have little vessels that run between them so that you can share blood flow over your entire face. So that means that injecting anywhere, really, cheeks, nasolabial folds, 11s, chin, jawline, all of that, if it's into an artery, it can go to the eye, and that can cause blindness. Okay, I think we're safe from the sun, but that's the reason that hyaluronic acid fillers, some people feel safer with, because there's a medication that you can inject to dissolve it. But that is an emergency. Now, it is super, super rare that happens. Super, super rare. And there are different places on the face that are more common to cause blindness than others. And even with that, it's still like 1 in a million chance that happens. Now, when it does, obviously it's very serious, and you have about 10 minutes to reverse things and to treat it before that blindness can become permanent. But there are a lot of techniques that injectors are taught in order to decrease that risk, but I, as a medical director, that's what I'm on call for, basically, the complications. If there's a problem that they need a physician to be around for to help dictate treatment, or to call a hospital or an ophthalmologist to get them seen, that's what I'm there for. And because of that, that's why I need to know about it, and I need to be up to date on these things. That's part of the obligation as a medical director. You're always on call for those problems. And that's why, probably the reason that I talk about it and other injectors don't. But other injectors, like I said, I don't do it. But it is a super rare complication. It is more common if you get injected in the cheeks. The 11s or the chin, strangely, are the areas that are the most common to cause blindness. Again, still 1 in a million. I wouldn't say stop doing it, because it is, like I said, a great tool. Now, the new thing is kind of, again, preventative filler. So, especially with patients who are on GLP-1s or have massive weight loss, you lose weight and fat in the face. And that can actually age you a little bit faster because you get that sunken kind of hollow look that people don't like. So let me know if you have any questions about anything med spa related. I'm happy to discuss further. Or if you want to get in for a consultation with one of our great estheticians, or have one of those amazing facials, we're more than happy to see you, discuss a plan for you, and customize what we need to do for you, because that is overall what you need the most, is a customized regimen and treatment plan for your skin, your goals, and that's what we're here to provide. So let me know, comment if you have questions or you want me to go over anything else. Thanks for listening.